Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Rosie Simpson, CEO of the Children's Hospital Foundation. Today, we are going to talk about the establishment of a new $5 million research center aimed at better understanding key issues in childhood nutrition and how to tackle them. Without further ado, welcome to the show, Rosie. It's very nice to have you here.
Thank you, Tabitha. Lovely to be with you.
Yes, my pleasure. So, Rosie, please tell the audience more about yourself and the nature of your work.
Oh, thank you, Tabitha. As the CEO of the Children's Hospital Foundation here in Queensland, I'm very humbled to be in charge of a small group of people that essentially raise over $20 million a year to fund into supporting sick kids and their families here in Queensland. So we're delighted that this week on Wednesday we officially launched the Woolworths Centre for Childhood Nutrition Research in partnership with Woolworths. And we've had a very long partnership with Woolworths and their customers who over the last 31 years have helped raise more than $51 million to help support sick kids across Queensland and New South Wales. We're now in the next phase of that partnership with Woolworths because this generosity has allowed us to fund groundbreaking medical research, life-saving medical equipment, as well as a range of services to support kids and their families in hospital. I would say, Tabitha, at the Children's Hospital Foundation, we're committed to funding research that's needed to find faster diagnoses, better treatments and ultimately cures for some of the most devastating childhood illnesses. And the Woolworths Centre for Childhood Nutrition Research is part of this ongoing commitment to improving the outcomes of sick Queensland children through world-class medical research.
That sounds excellent. Congratulations on this new center. I'm sure that this center will help a lot of children in Australia.
Absolutely. And over the next 5 years under this new centre, in its early stages, we'll award a range of program grants exploring themes around preventing and managing food allergies, for instance, in children, the dietary requirements that maximise health outcomes for children at certain ages. We're also going to look at the role of diet on gut health and the microbiome and the impact of that diet on brain development and mental health. A couple of the other areas we're looking at is childhood eating behaviours and habits, so fussy eaters, and how we help to inform the knowledge base around improving the nutrition for those fussy eaters. And we're looking at how we increase fruit and vegetable consumption amongst children, and right back to infant feeding and the importance of research in terms of adding to that body of knowledge around the importance of nutrition in infant feeding.
I agree with you. Children are very picky eaters nowadays. I'm a mother myself, so I know my daughter is very picky. There are times where I prepare dinner for her and she doesn't want to eat it. So Rosie, if you don't mind, I have a question for you. As a mother myself, what advice can you give me and other mothers out there? How can we get our children to eat healthy food?
Oh, I'd love to be able to give you direct advice about that. I mean, what the new centre, the Woolworths Centre for Childhood Nutrition Research, is designed to do is really do some groundbreaking research that will help exactly the sorts of messaging that both Woolworths and more publicly researchers can make about how to improve nutrition for fussy eaters, how to really look into food allergies. We're doing one of the very first pieces of research that we announced also on Wednesday is some work that Dr. Severin Navarro kicked off with us that really looks at hookworms, for instance, and the impact that hookworm proteins are having on people that are celiac. And it also has some implications for children that have a range of allergies as well. Her research is proving quite interesting for the impact of hookworm proteins on food allergies. So that work is in its infant stages, but is already showing some very positive signs that will enable celiacs, and obviously celiac is very hard to diagnose, particularly in children. But over time, we hope that will inform those faster diagnoses for children.
Very interesting. Yes, I hope so, because this center is going to help lots of children, especially when it comes to fussy eaters or children who are having allergies or those who have allergies.
That's right.
And speaking of allergies, I want to ask you, what is the state of childhood nutrition now in Australia? Because I've heard many reports that a lot of Australian children nowadays are obese. What can you say about this?
I think Australia is definitely following the global trend in Western countries for obesity, and I'm pleased to say that Queensland is already leading the way in pioneering groundbreaking research in childhood nutrition and dietetics. And through this new centre, we're hoping to build on that existing knowledge, really to accelerate progress in childhood nutrition research. Because we really, as you've identified, what we're seeing is we really need to address the health crisis that is around childhood nutrition and obesity, and we really want to improve the health of all kids now and into the future. It's critical and you'll see in relation to the Lady Cilento Children's Hospital, for instance, they've got a range of resources available on their website that really designed to make very practical recommendations to families and their children around better nutrition and keeping weight down, basically, as Australians and particularly for children.
Absolutely, that's true. It's better to tackle these issues when they are children, because as they get older, it's going to be more difficult for them to handle it.
That's right. Establishing those healthy eating habits early on, but also being aware that sometimes these issues come about because of gut health problems or food allergies, or, as we say, poor eating habits established early in life.
Yes, I agree with you. So, Rosie, if you don't mind, I'd like to ask you a personal question.
Absolutely.
Why are you so passionate about your work? Why do you like working with children?
Oh, thank you. I have been working with not-for-profits and related to supporting children for over 10 years now, and I guess the most obvious answer to that question is because children are the key to future generations of Australians. They're often the key to social change, and are also a wonderful group of people to actually deal with on a daily basis. I have the wonderful opportunity every day to walk through our hospital and interact with the patients and families that come into the hospital, and I guess personally I get enormous joy seeing the reaction that the families have to the high quality care that the Lady Cilento Hospital and all our children's health services in Queensland offer. But on top of that, we make their journey easier through the foundation. We provide volunteers from the moment they arrive in the hospital. That's scary. Where do I go and who do I see and what is it that I need to get together in terms of my paperwork? We have volunteers that help direct those early stage inquiries and stay with the families as they progress through the hospital and make sure that they know exactly where they need to be and what they need to have ready. Right through to volunteers that do cuddle caring in the hospital. That is, an availability of volunteers. So mum and dad who are dealing with very sick, very small baby can get some time to actually go and have a coffee and have some me time and organise the rest of their life while they're very busy, obviously focusing on getting their very sick child well again. And we run a TV service called Juice TV in the hospital at the foundation, which distracts kids. It's when you're in a hospital, it's a scary environment sometimes for kids. So the ability for them to be able to watch a really funny TV show, but also they actually become the compares and they do the interviewing on the show. So it's a TV program that's run by kids for kids in the hospital, and that's quite innovative and new in Australia and groundbreaking from our point of view here in Queensland on a national level. So we're very proud of the work we do, and personally to be able to be to drive improvements in that support that we offer the hospital, and to find cures for some of the most devastating illnesses is an incredible mission, I think, personally, for me to humbly be involved with the Children's Hospital Foundation.
Very nice. Thank you so much for sharing your story. And yes, I agree with you that children are fascinating to work with. Like I mentioned earlier, since I'm a mother, being around children brings such joy to people.
Yes, that's right.
So Rosie, I'm sorry, but we're almost out of time. But before we go, what is your main takeaway message to all of our listeners out there? What would you like to tell them?
I would like to say that supporting childhood nutrition is key. We're obviously very grateful for the support that Woolworths have provided, but we're always very keen to work more closely with people that are interested in whether it's donating their time, whether it's collaborating on research, or it's providing funds, much needed funds, to support what we do at the Foundation in supporting the very sickest of kids in Queensland and northern New South Wales. We're very keen to work with a range of people in whatever capacity they can.
Excellent. Thank you so much. And for those who want to contact the Children's Hospital Foundation, how can they do that?
Oh, they can go to our website, which is childrens.org.au, and that has all our contact details and more information about us as the foundation and how you can work with us. So thank you.
Yes, thank you so much, Rosie, for coming on the show. I really appreciate it.
Thank you, Tabetha. Lovely to talk to you. Appreciate it.
Yes, and congratulations again on this new research center.
Thank you. We're very excited.
And that was Dr. Rosie Simpson, CEO of the Children's Hospital Foundation. We just have been talking about the establishment of a new $5 million research center aimed at better understanding key issues in childhood nutrition and how to tackle them. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and you're listening to Health Professional Radio.